I'm going to let Dave pull this up. Sure. I'm Ian Brooks. I have joint appointments in the Graduate School of Library and Information Science and here at NCSA. NCSA, I serve as the Director of Health Sciences, so one of the things that entails is being the primary liaison between the organization and the health science community, so we get a lot of stuff coming in, working actually currently with BrownDog and Kenton on some digitizing handwritten notes for CDC. I'm going to talk mainly about my main project, INDICATOR. It's based off the idea that everybody has some sort of kind of concept of what's happening in the health of their community. There's a lot of data out there that may contain information about what's happening, whether it's school attendance, people saying they're sick on Twitter with an ANS flu mapper, or just going into stores and finding that there's no Tylenol on the shelves. But is that information actually usable? Is anybody going to make a public health decision based off it? I would say no. So what is INDICATOR? It's a framework for managing health data. What data? Well, we're looking at people, but we're also looking at animal data. And we're also looking at ecosystem environmental data. They're all completely intertwined. Most of the diseases are, 75% of new diseases come from animals. Around here, you only need to look at the first sign of West Nile is when crows start falling out of the sky. Mm-hmm. So you need to look at all of them together. So this is a very crude overview of INDICATOR. We get data from as many places as we can get our hands on, which immediately pulls into a BrownDog kind of need. Everything from veterinary through to eventually things like death certificates. We're taking this in on a daily basis, looking for outbreak detection, notifying our data providers, public health. It has, in fact, impacted public health policy in the local area that during the 2009 pandemic, they completely changed the vaccination strategy based off what they were seeing. One of the things we want to be able to get into is something very similar to what Mike was talking about with the Pecan project yesterday, of using the data to help narrow down the large parameter space for modeling. So basically, we're taking the idea that it's better to have imperfect data than no data. And imperfect meaning there is useful information in there, but it may not be ideal for disease surveillance. And that includes things like hospital emergency data, which can be too slow. People don't go to the emergency department as soon as they get sick. We take the data that's available. So that means that other people get to define the data that they're using. So where are we? We currently get data on a regular basis from emergency departments, a telemedicine center, reportable disease information from the state, attendance information from school districts, weather data, so that's something else that is a similarity with a lot of people. We get data from sentinel animal clinics, mosquito trap data, pollen data. A couple of different groups talking about pollen yesterday. I'm interested in pollen from an allergy perspective, and if anybody knows where you can actually get the numbers on daily pollen counts, as opposed to something completely made up by the Weather Service, I would like to know. We've looked, haven't found anything. So this is just a quick idea of what kind of data we're getting. This is emergency department, it's just 2-column. The right is completely free text. It's not anything that's structured, just 2 or 3 word clinical impressions, deliberately vague for medical billing purposes. The nurse call center data is just a count and a complaint. The veterinary clinic is a completely made up format that the guy pulls off his system. School attendance is just a spreadsheet. So we have a kind of preliminary kind of unified data format, looking at a very simple level, saying what is it we really need? It's just what's happening, how many, where is it? So everything we've got so far on the human and animal side fits into this format. We are currently, these are groups we're talking to as possible other sources, and these are all ones under consideration or under active discussion. The tools we're using, usual middle open source suspects. What are the possibilities for BrownDog? Obviously, the DAB, we get formats in whatever people want to give it to us, and that's come up somewhat deliberate because we want to take use of their data. It's not something, nobody's generating data for us. We're not collecting it for us. We're saying, it's out there, can we have it? Right now, we're dealing on a small scale. If I tell you that one of our partners has a concept note, they're shopping around funding agencies that says, let's take this idea and move it to a continental scale. We're going to have to be dealing with multiple languages, a lot of different issues, but how to really take this and make it scalable. Metadata extraction, we don't get metadata with anything. I was interested in the free text document comparisons, some of the stuff on that ED data we're getting. Sorry, Mike. And something Barbara said yesterday about some of the statistics as a service would be very interesting. Thank you.